and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we are talking about the physical therapy services with Kirkland Cancer Center, and my guest today is Sarah Hooper. She is the lead physical therapist with Kirkland Cancer Center. Welcome to the show, Sarah.
Thank you.
Thanks so much for being here. So I know that Kirkland Therapy Services just started back in July of 2024. I can't believe it's already 2025. That's so odd.
Right. That's correct. We did have some part-time. We were there a little bit over the last few years, but we just started actually having a department that was functional and there all the time in August. So we were excited to be able to be there full-time. So.
Great. So tell me a little bit about yourself, how you got into this position, or, how long you've been with West Tennessee Healthcare.
I've been a therapist for 27 years, and I've been with West Tennessee Healthcare for 15 years. And I've been doing lymphedema specialty for 10 years. Okay. So that's been my specialty in several different locations.
Great. So in terms of physical therapy, obviously you didn't start with Kirkland Cancer Center. So you kind of started more in the general physical therapy services.
Right. My career has been all over the place a little bit, which physical therapists tend to do. But I started in pediatrics. I moved into aquatics. We realized actually when I attended a little conference at Kirkland's when it very first opened that lymphedema would be beneficial for cancer patients. And I was like, why aren't we offering that at Aqua? Because the water is actually also a good tool to use with some of the patients.
Great,
so
yeah.
I got trained at that point.
So do you know kind of what started the therapy services at Kirkland Cancer Center, or were you involved in that, how it kind of came to be?
We had another therapist that was also lymphedema trained. She was one of my instructors and mentors also, and she was actually the first one that came in and began working with Kirkland's and came in kind of part-time, coming a few days a week, and then a little bit more, just a morning here and afternoon there, however we could get in, and then just to see the patients at their convenience.
Okay,
because if they're going through chemo, radiation, those kinds of things, to have it right there on site is much more convenient.
Right, yeah, and I was going to ask you that too. So I guess in the past it would have been they were sent to, another physical therapy location. So talk to me about how that is important that it's all at the same location.
I think it's just a great tool. The doctors know we're there. We have better access to the doctors, to their care, and they can stop in if they need to ask something. Also, we can catch them before or after treatment if they're coming in. They're coming in so often during treatment, so that's a way that we can catch them. And they just are familiar with it. It's such a kind place. It's such a sweet place to be, and they feel at home there.
Sure. So, and is this at just the Kirkland Cancer Center that's behind Jackson General Hospital?
Correct.
Or is it also at the North one as well?
Just at the one that's here close to the hospital.
So these services are offered at the main Kirkland Cancer Center near Jackson-Madison County General Hospital. And you have been doing it since July of last year?
Since August, yes. I was actually there 2 mornings a week prior to that. Oh, okay. We were just
as it was ramping up,
right? Yeah, we just kind of had a little cubby hole back in the back, and then it was in August that we have more of a space and more of a presence where we can have more than one of us there. There are other lymphedema therapists, and there are other populations that we serve as well, not just cancer. So having that location that anyone could come to that was accessible, that was a big thing, just to have the physical location.
Right, yeah. And in terms of your past, how long you've been doing physical therapy, this particular therapy, now that you're with Kirkland Cancer Center, what has it been like? How has it been different? Or what have you noticed in this particular role?
We are able to reach more of the cancer patients. I feel like we are having a bigger referral base of the cancer patients because, again, this lymphedema is something that affects other populations besides just cancer patients. But just having us visible, the patients may not realize what's going on, and then we can educate them and allow them to get the care they need quicker.
Right. Have you had any success stories that are anything that has kind of made an impact with you through these services with anyone that you've met or helped with?
I do. I love my patients. One of the things that I have noticed being there, like I had a patient that came in not too long ago who was also having some nutrition issues. I was very quickly able to get her to the dietitian. So some of those things that would have been such a, make a call and wait for a referral, do this, try to figure out who I'm supposed to talk to. Now that I'm there and on that team, I can see these patients' needs a little bit more.
Right.
And the other people are beginning to know, and therapy could come in and help with that. So we had a patient who wasn't even, I didn't actually see her on an ongoing basis, but I was able to help the doctors get something for her for compression that was needed for some swelling that she had, just kind of on that day off the cuff.
Okay, so it is something that's kind of, things happen faster.
Right.
It's kind of a more, I guess, convenient, and I would assume, just as a layperson in the medical field, I'm working adjacent, medical field adjacent, is that things don't fall through the cracks, I guess, when you're at different locations or with different services and different companies and all that.
Right, because phone calls take time and emails take time, and someone sends you an email, you not see it till the next morning.
Right.
Those types of things. So we can eliminate some of that between work. Plus, they just know my face.
Right.
That not just the patients can kind of know my face a little bit better, but also the doctors and nurses can be like, oh yeah, therapy's downstairs. Just stop in and see if
And the same with my chart through West Tennessee Healthcare, they just kind of integrated it with the hospitals and with the clinics, and so just having a MyChart account where everything's kind of all in the same place, I think that.
Yeah, MyChart, it works well with just integrating, because all their information is already in there. They know the location too.
Right,
all of that is kind of in place, and then we are also not having to duplicate all those things over again for
and
the
that's
patient.
Just more time consuming. This is more time for you to focus on the patients and not so much on paperwork and things. So I know we've been talking about lymphedema a lot, and I haven't actually asked you if anyone listening is not familiar with lymphedema. Kind of tell me what that means, what that entails.
Lymphedema is basically swelling. It's swelling that lasts for a longer period of time, and so we kind of classify anything that's swollen for more than 3 months and there's not some kind of a specific cause that's going to disappear, then that's lymphedema. Okay. That's where that tissue has been clogged with fluid, stayed stagnant, it's not moving itself out easily, and then we come in and we're able to help with a massage technique that kind of helps move that fluid out, and then we use compression to help hold the swollen area down. And we want to get people consistent compression that they can put on themselves, because it is something that is a long-term. Lymphedema, once you're diagnosed with that, is usually a chronic condition that you just kind of have to manage, not cure.
Right. And in terms of cancer, how does it play into that?
A lot of the patients with cancer, if they've had any lymph nodes removed, of course that affects the lymphatic system.
Right.
So that can cause it not to drain correctly, and then you get a fluid backup. So some breast cancer patients, if they've had lymph nodes or radiation in their shoulder or armpit area, then they're going to have possibly swelling in that arm. So we're able to go in, do the massage that helps relieve some of that, and then put them in a sleeve or a glove that helps hold that compression down.
Is there a specific, is there like a time frame that those therapy services usually last, or is it kind of just based on the patient?
It's very much based on the patient and
how long it lasts, or
how severe the lymphedema is. We have limbs that are 2 to 3 times the size of the other limb. And then we have people that come in and they're just barely swollen, but it feels heavy to them and they're having trouble with movement.
Yeah.
Then that's easier to get down and get them in a garment and go ahead and get them done. And they're able to go on with their lives and know how to manage it. And then we also are seeing patients there that are not necessarily lymphedema, are not necessarily swollen, but they have tightness because they've had radiation. So they might have tendons and areas that are tight because they've had radiation, or because they've just had surgery and they've guarded and they've been nervous about moving it. So that's something that we are growing as well. We've started doing free screening Fridays, which is that patients can come in and talk to us, and we'll do a little quick assessment just to kind of see, are you having trouble with range of motion? Are you having trouble with reaching up into a cabinet? Are you having trouble with your balance? Those kinds of things that go along with cancer treatment. We're right on site to be able to do that as well.
Right. And you just mentioned something. It's funny because I wasn't even thinking about cancer patients with physical therapy that, with radiation and chemotherapy, that there are obviously it takes a physical toll, but it didn't occur to me that that was something that could be helped through physical therapy.
And generally, we have not been able to do that until we came over here.
Right.
We were just seeing the lymphedema patients, but now that we're on site, we can catch some of those patients that it's not lymphedema, not necessarily. It just is tightness or weakness. Because I've had patients, you asked for examples of patients too. I've had patients who have had maybe a less invasive surgery, but they were afraid to move. And they've come to us 6, 8, 12 months later, and they're still not moving because they just were scared. And so then they've gotten kind of locked down, and we've been able to help release some of those things. So,
because that's, quality of life, range of motion. I mean, that's
absolutely.
So
and during going through cancer treatment, there's a lot of fear. There's a lot of like, what's next? Is this permanent? What's happening to my body? So just being able to be a part of that team that helps them move better and have a better quality of life.
Exactly. Yeah. And I think it is important. I'm glad that we're doing this for the general public to know, that physical therapy services are important for cancer patients. That's maybe not something that's widely known at all, really.
Right.
Now, you mentioned free screening Fridays. You want to talk to me a little bit more about that?
Right. We just got that going, actually, just as we've been able to build our staff up and have a more full staff over there. Just allowing the patients to come in, just stop in. The doctors say, hey, run down to the therapy department and get a screening. Yeah. Just 15 minutes where we just go through questions of, are you functioning okay? Do you have any questions? Like, is there anything physically that's going on that maybe, the doctors are focused on curing that cancer, as they should be, and they are brilliant. And so we are just a piece of that puzzle to say, is there a movement problem that is, that has come up because of the treatment, and just to catch those people. So again, it's a quality of life thing.
Right. And then is this for current, like you're already a patient with a Kirkland Cancer Center physician?
The services at Kirkland Therapy? Or not necessarily. Okay. We also are seeing patients, we get referrals from primary care. Okay. We get also referrals for legs, because we have a lot of patients who have poor circulation also causes lymphedema. So people with very poor circulation will develop kind of wounds on their legs and things like that. So that's part of the lymphedema world as well.
Yeah, and it's all interconnected, I can imagine.
Right,
yeah.
And so we see all of that as well.
Great. So if there are any current Kirkland Cancer Center patients who are maybe not aware of the Kirkland therapy services, what can they do to kind of get information about it or learn more about it?
You can stop into the clinic. We are right in the lobby. We're right there up front, and the sign's on the window that says Kirkland Therapy Services. So we're very visible at this point, which is great. Stop in and see us. And we do have some pamphlets out in our lobby, and we're happy. We're there Monday through Friday, so we're happy to answer questions as well for anyone who stops in.
Great.
So if you go to Kirkland's Cancer Center, you can't really miss us, which is great.
Yeah. Well, all right, Sarah, thank you so much for coming by and talking to us about this great new service with Kirkland Cancer Center.
Right. Thank you so much.
Thank you. Thanks for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretaker. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.